Mark, one of our team from Chad, to introduce the speakers.
Thanks very much, Chris. Just to echo that, really, a really warm welcome to our speakers. I'm really honoured to chair the session today. As Chris mentioned, I'm one of the Chad researchers and I got a particular interest in gender, and I'm currently looking at women, homelessness and multiple disadvantage. So I'm really looking forward to both speakers. As Chris mentioned, if you can put your questions in the chat. Also like to encourage you to engage with it with the react symbols in the Teams, just so we can show our support for the speakers as we go along. So we're going to start off with Dr. Mary-Ann Stephenson's presentation, and then we'll move on to Dr. Vicky Riley's presentation. It's a real privilege to have both of them with us today. So Mary-Ann is the director of the Women's Budget Group, which is an independent and not-for-profit membership network aiming to promote gender equal economy and a gender equal future. She's been active in the group for over 20 years and was appointed as its first director in 2017. Just to give a flavour of the wealth of experience she's also got, she's been a freelance consultant specialising in women's equality and human rights, and is a trustee of Coventry Rape and Sexual Abuse Centre, and also has a PhD in law from the University of Warwick. So as Chris mentioned, she'll speak to us about the gendered impact of COVID-19. The website for the Women's Budget Group, I'll pop the link to it in the chat because that's a great resource, and there's lots of accessible information and animations and stuff on there as well, which would be well worth a look. And so Dr. Mary-Ann will speak for 20 minutes, then we'll move on to Dr. Vicky Riley, one of our other Chad researchers. And I think Vicky really symbolises what it is to be proud to be Staffs. She did her undergraduate degree here, and she's done a master's in health psychology with Staffs Uni, and also a PhD which looked at risk communication and health checks. And that included training which has now been commissioned by several local authorities since as well. Vicky works across the Chad themes. She's interested in risk communication and health checks, but also health promotion and behaviour change and prevention. She's going to speak to us today about some work that she's been doing with colleagues around the impact of restrictions on pregnancy, and that's been published in the Journal of Midwifery, and I'll put the link to that in the chat as well shortly. So if I can hand over to Dr. Mary-Ann, and again, put your questions in the chat as we go along, and thank you very much.
Thank you very much, Fiona. It's great to be here. I'm really pleased to have been invited. I'm just going to share my screen because I've got some slides to show you. Get that set up. Okay. So I'm going to talk about the impact of COVID-19 on women, and because our focus at the Women's Budget Group is specifically about the economic situation of women, I'm going to primarily focus about the impact of COVID on women's economic situation. But before I did that, I wanted to talk a little bit about why COVID had the particular impact that it did do on women. And I wanted to start by showing a slide that we created, which was for our Commission on a Gender Equal Economy, which published during the middle of COVID in September 2020. And one of the findings of that commission was the central role of care in women's economic situation. So because women do more unpaid care and domestic work, 60% more unpaid care and domestic work, and this leaves us less time for paid work, which is why women earn less, own less, are more likely to be poor throughout their lives and in old age. But it also means that economic policies impact differently on women and men. So, for example, the austerity cuts to social security from 2010 onwards affected women more than men. And similarly, the tax cuts that happened at the same time benefited men more than benefited women. And this is really to explain the context and the background for why the COVID pandemic and the government's response to it affected women differently. So just to start with the sort of overview, women were the majority of people furloughed during the pandemic, and were also less likely to have their pay topped up by employers because women are more likely to be low paid, and low paid workers were less likely than better off workers to have pay topped up by employers. But women also faced an additional burden of care. We know that the additional work created by school closures fell mostly on women's shoulders. In fact, research done by the Institute for Fiscal Studies in 2020, looking at heterosexual couples with children during COVID, found that the only situation in which fathers and mothers did equal amounts of care were where the father wasn't in paid work at all or had been furloughed, and the mother was continuing to work outside the home, so was a key worker in some way. And in those situations, the level of childcare done by men and women was broadly the same. But in all other contexts, when both were working, when both had been furloughed, women were doing more unpaid care than men. And that's one of the primary reasons why women's mental health suffered more than men's during the pandemic. And looking forward now, with the cost of living crisis, women were more likely than men to struggle financially and to get into debt as a result of COVID. And we know from work by Women's Aid and the End Violence Against Women Coalition that women suffered increased levels of domestic abuse, and there were increased levels of femicide during the pandemic, particularly the first stage when people were trapped at home with their abusers. But COVID affected different groups of women in different ways. So we can see the way in which gendered inequalities intersected with inequalities based on class and income, on age, on race, on disability, and on motherhood, and particularly single motherhood. And it's that I really want to go through in more detail in my talk today. So first of all, if you look at income, we know that prior to the pandemic, women predominated both in low-paid jobs and in key worker jobs, and actually many of these jobs overlapped. And we also know that there was a sort of double pattern during the pandemic. So higher income families increased savings as they were spending less money on commuting, less able to eat out, less able to go on foreign holidays. Lower income families increased their levels of debt because of being furloughed, losing jobs, losing hours, and in some cases having increased costs from having to be at home all the time with the children. We know that 13% of low-income parents lost their jobs during the first period of the pandemic, and were less able to work from home. So working from home was something that was presented as what we were all doing. In actual fact, large numbers of working class women either carried on working outside the home during the pandemic because they were key workers, or were furloughed or lost their jobs. They were far less likely to stay working from home. And some research that we did with a range of other women's organisations showed that mothers on low incomes were particularly at risk of losing jobs during school closures because of having to take time off, and because of not being able to do what some professional women were able to do, which created additional burdens, but at least was possible, which was work incredibly long hours, early mornings, late evenings, and look after children who were at home. Women who weren't able to work from home had to take time off work, or indeed leave their jobs altogether. And although furlough was possible in those circumstances, it wasn't very highly advertised by the government. So a lot of people and a lot of employers didn't realise it was possible to be furloughed for childcare reasons. So women ended up losing their jobs. There's also impacts by age. We obviously know the health impacts for older people, but if you look at the economic impacts, particular impacts for younger people and younger women in particular, over a third of women worked in sectors that were completely shut down during the most severe closures during the pandemic. And as a result, even within the first 6 months, over 1.5 million young women had lost income as a result of not being able to work or reducing their hours. And young women in particular were likely to report severe mental health problems during the pandemic. And this period out of work, or period in shutdown sectors, does have a long-term impact on career progression and earnings, even as the economy opens up and even as we're now in a situation where we've actually got quite a tight labour market. That period out of the labour market at a young age can have a scarring effect throughout people's lives. We also know that employment among Black and minority ethnic workers was particularly hard hit. Employment for Black and minority ethnic workers, according to the TUC, fell more sharply than for white workers in a way that wasn't explained by the sectors that they worked in. And in 2021, Black and minority ethnic women had both the highest rate of unemployment and the lowest rate of employment. So there's a particularly high rate of Black and minority ethnic women who are either unemployed or what's called economically inactive, which means not in paid work or seeking paid work. A lot of that was for caring responsibilities and health impacts, particularly later on in the pandemic as a result of long COVID. Again, we know that disabled people were particularly badly hit by the health impacts of COVID, but they were also badly hit by the economic impacts. So we did a study fairly early on in the pandemic during the summer of 2020, which showed that a third of disabled women had reported having run out of money at that point, compared to a quarter of non-disabled women. And we also know that disabled mothers were more likely to be furloughed than non-disabled mothers, again from research that we did with a range of other women's organisations. As I said at the beginning, mothers were harder hit by extra unpaid work. So women as a whole spent 3.5 hours a day in childcare compared to 2.5 for men. Obviously that rate was higher when you looked at mothers in particular. Nearly half of mothers who were made redundant during the pandemic said that childcare or their inability to find childcare was a factor in their redundancy. And more than 70% of working mothers who requested furlough for childcare reasons had their request denied. Single mothers particularly likely to be badly hit. Single parents prior to the pandemic were more likely to do jobs that weren't able to be done from home, and we saw that play out during the pandemic. So there was a 21% increase in single mothers working from home compared to 38% increase for women in couples. Single parents were more likely to have been furloughed and to have stayed on furlough for a longer period. And obviously childcare costs, when set against one salary rather than two salaries, create particular problems. So 38% of single mothers said that childcare costs caused additional debts, forcing them to cut back on essential items such as food, heating, clothing and housing costs. So this is even before the cost of living crisis. We saw single mothers really struggling to get by. And as a result, during the pandemic, we saw an increase in levels of debt, particularly in poorer households. So over 10 million adults in Great Britain showing signs of financial difficulty and 2.4 in problem debt. That was by January 2021. At least 1.7 million adults had run down their savings completely. And nearly 1.5 million had used more than half of their savings to pay for essentials. And again, this is important when we think about the situation that we're in now, that we're talking about millions of people with absolutely no cushion to deal with the rising cost of living because it was all wiped out during the period of the pandemic. So post-pandemic, we are seeing a bounce back in the economy and in jobs. We've got a tight labour market, so 1.1 unemployed people per vacancy at the end of last year. That's actually gone down, so there's now more vacancies than there are unemployed people. Unemployment is down, close to pre-crisis levels, but employment has not recovered from pre-crisis levels. So what we've seen is an increase in economic inactivity, particularly as a result of long-term sickness, but more recently also as a result of caring responsibilities. And the increase in economic inactivity for January this year was highest among women aged over 55. So that's women who are either unable to work because of long-term sickness, or in some cases giving up work altogether in order to care for grandchildren because of the cost of childcare that their children are facing. And that has long-term implications for their pension situation and their poverty in old age. So we're seeing women's employment rate still slightly lower than men's post-COVID, and a similar pattern of just under 40% of women in paid work working part-time. And again, that has a knock-on effect with the rising cost of living because of the inability to pay for day-to-day expenses. You've got a crisis in an earnings gap rather than a pay gap. So the pay gap is the gap between pay per hour for people working full-time. The earnings gap is the gap in earnings per week, and it's much more significant, and that's to do with women's unpaid work, which means they're more likely to work part-time. We have seen some benefits. So remote working has led to an increase in hours for some women, and for some disabled women, remote working has opened up new employment possibilities. Mothers in couples said that they were able to increase their working hours or enter work because of remote working, because there wasn't the commute to deal with, which makes managing childcare more accessible. But working class women are still less able to work remotely. So we're seeing problems there with, you know, the changing working patterns benefiting some groups but not others. And now we're in the cost of living crisis, and I think it's really important to emphasise that this isn't just about rising prices but also about low incomes. It's not just a crisis of fuel costs and food costs, it's a crisis of social security and a crisis of low pay and low earnings. And as I said, pre-existing debt from COVID leaves people less able to cope. Now, we finally saw some additional payments last month from the Chancellor, additional lump sum payments to people on social security, which is very welcome. However, there's some significant problems there. First of all, the payments are divided into two, and the only those who were actually registered as claiming social security benefits the day before the Chancellor made his announcement qualify for the first payment. So anybody who lost their job on the day of his speech or subsequently won't receive that first payment, so won't receive any additional help. And also, because it's a flat rate payment, it doesn't provide additional help for larger families who are particularly likely to be overstretched. There's no allowance made for the additional costs of more children, and we have called repeatedly for the government to also increase child benefit as one of the most effective ways of getting money to families and to children, and to remove the two-child limit, which effectively penalises children for what the government sees as the failings of their parents. So I think I'm running out of time now. Just move quickly on to our recommendations. First of all, we need a significant investment in social infrastructure, particularly care infrastructure, and we've published reports calling for a care-led recovery from COVID, which I can share in the chat in a minute, and also a report modelling a free universal social care service and looking at the costs of that. We need social security payments to not just increase in line with inflation, but actually go above that, because we've had 10 years of below inflation social security, which means that the value of social security has been dramatically eroded over that period. We need to make sure that the childcare element of universal credit is paid up front rather than in arrears, to help people getting back into work, and the no recourse to public funds rules. We're very pleased that the government has listened to us and many other organisations calling for a windfall tax on utilities, but we are concerned that that has an exemption for investment in oil and gas exploration in the UK, which obviously undermines the government's commitments to tackle climate change. We don't think those exemptions should be there. If there are exemptions for utilities, it should be for investments in renewable technology, not investment in polluting fuels. So that's the end of my talk. You can find out more by visiting our website. My email address is there if anybody wants to email me, and I'd be very happy to share my slides with the organisers if people want to be sent them afterwards. Thank you very much.
Thanks very much, Mary-Ann. That was really insightful, and I think shows clearly how the lasting impact of COVID as well on the cost of living crisis as well just now. We've had a couple of, well, quite a few more questions now in the chat, so that's great. Keep them coming and we'll pick them up after we've heard from Vicky Riley as well. So over to you, Ricky. Thank you.
So, hi everybody, I'm just going to share my presentation just now. Okay, so yeah, thank you. My name's Victoria Riley, and as Fiona's mentioned, I'm going to be talking about the impact of COVID-19 restrictions on women's pregnancy and postpartum experience in England, and that's from a qualitative exploration. I led the project with my colleagues, Dr. Naomi Alice, Lorna McKay and Dr. Jenny Taylor, that are all based here at Staffordshire University. So just to talk a little bit around the impact of COVID on pregnancy, early research at the beginning of the pandemic showed an increased risk of complications, particularly in the second half of pregnancy and latter stages of pregnancy, including preterm delivery and hospital admissions. Therefore, as a protective measure, the UK government included women among the groups considered vulnerable to coronavirus in March 2020. For that reason, non-essential care was stopped, appointments were offered virtually, and mothers were required to attend scans alone, and also to attend early labour alone as well. Whilst restrictions have now eased in the UK, there is evidence that they have led to elevated emotional distress in pregnant women and new mothers. At the beginning of conducting the research, evidence for the impact of COVID-19 restrictions on the experiences of pregnant women and new mothers was quite limited, given the fact that we were kind of in this sort of unknown territory. The evidence available suggested that the pandemic had resulted in changes to communication, social activities, and restricted access to maternity care, including a lack of support from health professionals and friends and family, feeling burdensome to others, and a negative influence of the media on risk perception. Interviews with women with COVID-19 symptoms or those who had been exposed to the virus also showed that the pandemic had led to feelings of isolation and threatened economic and food security during pregnancy and postnatal. So, myself and my other colleagues wanted to try and understand the impact of COVID-19 restrictions on women's pregnancy and postpartum experience, to understand exactly what was going on and what kind of impact it was having on them. So the study followed a qualitative design, so we did a combination of telephone and email interviews, and that was to maximise the convenience for participants, but also as a safety aspect. Participants were contacted following completion of an online survey that we distributed. It is unpublished, but that was to understand the impact of COVID during the first lockdown in England. So that was distributed between March and July 2020. So women who were pregnant at the time of completing that survey and consented to be recontacted were asked, well, they're invited for the interview to talk about their pregnancy and postpartum experience. Participants were also recruited through contacts known to the authors and through survey respondents who participated, so kind of like a snowball sampling. And participants were given a £20 retail voucher in appreciation of their time. We managed to complete 25 semi-structured interviews, and they were conducted between July and August 2020. The majority of participants were recruited through completion of the online survey, and were from England, had already given birth at the time of the interview, and that was their first child. And no participants had confirmed coronavirus at the time or prior to the interview. Data were analysed using inductive thematic analysis by 2 members of the team, myself and Lorna, and then they were finalised by all 4 authors. So we resulted with 4 themes, including COVID restrictions totally changed the whole experience. The lack of information on top of this situation will probably make you quite anxious. The birth experience was nowhere near as bad as I thought it would be. And isolation, that was the hardest. So I'm just going to talk you through each theme that we found. So the first theme, COVID-19 restrictions totally changed the whole experience. The actual restrictions that were imposed by the UK government because of this vulnerable status impacted on women's pregnancy and postpartum experience, including their access to appointments, antenatal and baby classes, and the ability to actually share their experience with others. Appointments were either missed, they were attended alone, or they were virtual. So there's a bit of a reference there in the red speech bubble. So being excited about midwife appointments, but actually not being able to enjoy their experience with others because they had to attend alone. Alternative formats, including online classes, were not considered the same by participants, and they worried that their baby wasn't going to be as sociable because they'd only spent time with their parents and the occasional health visitor if they managed to get a face-to-face appointment. Participants talked about having sympathy for first-time mums and the things they would have been missing out on. And suggested that their experience wasn't what they thought it was going to be pre-pandemic. And they also felt that the pandemic meant their partner had missed out on the same experience. And participants worried about being alone and being told that there was something wrong with the baby or that their partner would miss the birth because they weren't allowed to be present during early stages of labour. The second theme, the lack of information on top of this situation, will probably make you quite anxious. Isolation, despite the emotional turmoil of everything else that was going on, the fact that they had a lack of information about sort of the changing events of the pandemic was really worrisome for participants because they weren't getting a lot of information. And they did appreciate the fact that things were changing on a daily basis, but that was quite worrisome for those that were due to give birth. So participants, for that reason, relied heavily upon online resources for information. And some said that that was helpful, whilst others said that they weren't so helpful. So a particular example there is the yellow speech bubble. So I used several Facebook groups where women who were pregnant and giving birth during coronavirus, loads of them all around the world, and they were all posting their positive experiences. So that particular participant found that online resources were really helpful, whereas others found them not so helpful. And for that reason, some participants resorted to friends and family for advice and to learn about birth and aftercare. The third theme, the birth experiences, were nowhere near as bad as I thought it would be. So despite all of this emotional turmoil of kind of the limited information and the changes to their kind of anticipated experience of pregnancy, the majority of participants actually had a really positive birth experience. And participants commended the hospital staff for their care despite the pressure of the pandemic. So the yellow speech bubble, for them to be so happy and so kind and so patient when they are under an incredible amount of pressure was just incredible, and there was just a lovely atmosphere on the ward. So it just kind of shows that despite all of the pressures that were going on in the outside world and what the staff were kind of facing within the hospitals, that didn't have an impact so much on the ladies once they were actually in the hospital on the wards. So participants felt that their concerns had kind of slowly slipped away and they were able to focus on the birth of their child. And some also commended hospital staff for supporting them in the absence of their partner, so their partner couldn't actually be present on the labour ward at the time. And they were also supported by other mothers that were on the ward. So there was a kind of a sense of a community presence whilst in the hospital to try and support these new mothers. And our next theme, the isolation, that was the hardest. I think for the ladies, the isolation was the hardest part of the restrictions, and they found that really challenging. So separation from friends and family was difficult because it wasn't what they were anticipating, and kind of everybody says it takes a village to raise a child, and I think a lot of the ladies that we interviewed kind of really felt that presence was missed from friends and family. Breastfeeding was difficult for some participants as well during the restrictions, as they didn't feel that they received adequate support. Breastfeeding services did attempt to provide virtual support during the pandemic, but participants felt that the physical support that they have received if they'd already had a child previously was just irreplaceable, and it couldn't be something that could be done on Teams, for example. Yet other mothers felt that the isolation was actually a key to the success of their breastfeeding journey, as they had nowhere to go, no visitors to kind of attend, so they were able to focus on the latch with the baby, for example. So they actually commended the impact of the pandemic and helping them to improve that bond with the baby. But isolation from friends and family was difficult. As I've already mentioned, it led to emotional distress for a lot of the participants, because family weren't able to attend and kind of help with the responsibilities and kind of share the load. And so the yellow bubble there, I was crying half the day because I was tired of having to do things like FaceTime with the family. So that emotional side I feel being isolated. So I think that in particular was really difficult for a lot of the participants. But to kind of get them to think about the positive aspects of the pandemic, participants appreciated the additional time that they were able to have as a family, particularly if their partner had been furloughed or if they were working from home, they had that additional family member there that was able to support them. So they found that incredibly helpful. So interviews with women who were pregnant or had given birth during the first UK lockdown suggested that they'd missed out on key moments of the pregnancy experience due to the pandemic. And limited access to information led to an increased fear and anxiety for participants who resorted to non-medical online resources for help and support, and also support from friends and family remotely. But despite this, the majority of those interviewed had a positive pregnancy and birth experience, emphasising the safety procedures and the special care that they received from the midwives, which really helped them to feel safe and protected. Prolonged restrictions both in and out of hospital led to fear about attending antenatal appointments alone and feelings of loneliness due to isolation from friends and family and health professionals. Isolation appeared to have a profound effect on participants' experiences, highlighting the need for adequate support during all stages of pregnancy and postpartum. Cases of coronavirus continue to fluctuate in the UK. It's a bit harder to obviously see now that the statistics have largely been removed, but there are still fluctuations. And the loneliness felt as a result of the pandemic has had a considerable impact on pregnancy and postpartum. And guidance now permits support for pregnant women during scans, appointments and labour. And I think just recently, particularly locally, there's now added support during visits if they're on the labour wards. And I think now children can also attend those wards, but that's only very recently. But it's incredibly important that that continues to protect the emotional well-being of pregnant women and new mothers. And whilst it is recognised that little information was known about high-risk individuals at the start of the pandemic, and treatment for those infected was priority, it's important to ensure that pregnant women and new mothers are equipped with the latest information available about services for advice and support when things like this arise, like pandemics and epidemics, to reduce further distress for mothers and the unborn baby. And where virtual support continues, community breastfeeding support could be improved for new mothers, especially given UK breastfeeding rates. So I just want to talk to you a little bit about kind of a 12-month follow-up that we're currently working through. So we recontacted the 25 participants that participated in an interview with us to find out if they would be willing to speak to us again to understand their experiences since their first interview, to find out kind of what's been happening since. So again, it was a qualitative design, including both telephone and email interviews. We conducted 13 interviews and they were between October 21 and January of this year. As with the previous sample, most were from England, had already given birth prior to the first interview, and that was their first child. So I'm just going to give you a bit of a run through quickly of what those preliminary findings are, but the continuation of COVID-19 restrictions during that time period between the two interviews and the lack of physical contact and support from healthcare services led to mental health struggles in many of the participants we interviewed. That seemed to be really evident across the sample that we managed to get. This included their own mental health struggles such as anxiety, depression and loneliness, and anxiety and concerns about the health and development of their child. So participants talked about adapting to the new normal to keep safe from COVID as restrictions were being lifted, and they were thankful that they could take their child or children to places that they couldn't previously. Some talked about bending the rules to meet their needs, whilst others were concerned about their immunity and so were more cautious about venturing out with their children. Some participants lengthened their maternity leave in the hopes that they would have the option to take their children to places that they'd missed out on, whilst others decided to return to work early because they felt that they just weren't getting the experience that they thought that they would be getting whilst on maternity leave. The lack of support from friends and family due to the restrictions remained difficult for participants, especially for those who had chose between parents to create support bubbles. So if you remember, they could kind of create a support bubble with just one other household. So it was difficult for mothers and the partners to kind of decide between the grandparents. So some decided to kind of bend the rules whilst others just chose not to create a support bubble at all. But some participants suggested that a lack of socialisation with others meant that their child's relationship with grandparents and others outside of the household had actually suffered, whilst others suggested that the secure attachment that they'd created with their parents actually helped them to become really confident and independent young children. Participants with older children resorted to comparing their child to their siblings, and they felt that their child had been cheated as they had missed out on so much due to the restrictions that their older sibling wouldn't have missed out on pre-pandemic. And this meant that returning to work was made more difficult for participants as they were worried about how their child would adapt to being away from the parents and not actually having that relationship with their grandparents, or having to be taken to a nursery setting. Some suggested that the settling in period took longer than their previous children, whilst others said that they saw a big difference in the child's development and their relationship with others once they were actually able to stay with others. We're currently in the write-up phase of this follow-up research, but we're hoping to be published by the end of this year. So hopefully you can look out for more information about that piece of work. But thank you very much.
Thanks very much. Funny echo there. Yeah, really fascinating. Also interesting to hearing some of the positive and negative impacts as well for the women and their experiences. We've had some great questions come through already, so please do keep putting them in the chat and we'll keep an eye on them as we go through. I've got a couple of policy ones first. Mary-Ann, if we can start off with you on that front. So one around the Scottish Government from a colleague north of the border. Talking about how the Scottish Government has tried to address some of the issues that you talked about in your presentation, perhaps more focusing around affordable childcare, but just if you're able to comment on any differences and impacts of the different government policies across the UK, please.
Yeah, no, absolutely. I mean, I think one of the things that devolution has shown, and the different governments in different nations of the UK has shown, is that a lot of these impacts are not inevitable. You know, there is a result of policy decisions, and certainly in Scotland we're seeing a far greater focus on the importance of care, both childcare and adult social care. Some of the issues, particularly around social security, are not devolved in the same way, and so there's less power to do anything about it. But there's certainly much greater engagement in both Scotland and Wales around equality impact assessments of policies, for example, and a determination to recognise the gendered impact of policy. I mean, the situation in Northern Ireland is different again because of the series of situations where Northern Ireland hasn't really had a functioning government, which has made things very, very difficult there. And there's no childcare strategy in Northern Ireland, for example. But yeah, it definitely makes a significant difference. We have a sister organisation, the Scottish Women's Budget Group, who's done a lot of work, and we did work with them on COVID and on care. But you can find their website, and that's got a lot of really good information on it too.
Brilliant, thank you. And another one, policy related, is asking about your experiences of engaging with government to try and relay some of these messages and make recommendations, and how well sort of they are received, and what your experience is.
Not brilliantly with this government, to be honest. I mean, it has been very frustrating, and there is a real failure to understand gendered impact. And for example, some of the changes that we've been highlighting and others have been highlighting are relatively minor. So for example, from the beginning of the pandemic, Maternity Action was highlighting the fact that the support for self-employed people worked out people's average earnings, self-employed people's average earnings over the 3-year period before the pandemic started, but didn't exclude any periods on maternity leave. So obviously, if you include that period where if you're self-employed, you won't have had any income apart from maternity allowance potentially, your average earnings are going to be lower. Now, it would have been very easy to say we're going to calculate the average excluding periods for maternity leave or long-term sickness, for example. And that was pointed out from the beginning repeatedly, and they refused to take account of that. The Women Inequalities Select Committee highlighted the failure of the government to do a proper gendered impact assessment of any of their COVID policies, and in things like the furlough scheme for childcare reasons, the government did finally agree that yes, you could be furloughed for childcare reasons, but made no effort to publicise this to employers. So most employers didn't realise, and you've got large numbers of women working for very small employers who don't have HR teams who can keep up to date with regulations and so on, who when they requested furlough were just told no, because employers didn't think it was possible. So again, it's not just a failure of policy, it's a failure to communicate policy or to take that seriously.
Thank you. And I guess just as a follow on from that, would you have any advice for people trying to sort of influence policy then around the gender topic? And
so, I mean, what we've been doing, we still push for meetings with ministers and officials, and sometimes we get some meetings, but not at the level we have had under previous administrations. So a lot of the work that we've been doing has been through select committees, for example, which have been open to this. So, the Treasury Select Committee did a big inquiry on the impact of COVID. The Women Inequality Select Committee did a big inquiry on the impact of COVID. And so trying to raise and push these issues from the back benches. But it is also clear, I mean, this government does respond to external pressure. I mean, they did make additional payments to people claiming social security. They weren't sufficient, and they still refused to actually raise the overall level of social security. But I think the campaigning by large numbers of different organisations and kind of high profile celebrities and things did make a difference, and did make them decide to offer those payments.
Thank you very much. Vicky, is there anything you want to add on the policy front or influencing?
No, that's okay, thank you.
So if we move on to the next one, then a biggie around how we could change societal norms about women taking on the vast burden or vast responsibility of childcare.
I've got loads to say on that, but I don't know if Vicky wants to go first because she hasn't.
I guess just to kind of, I think it's an incredibly difficult one. It shouldn't be, but it seems to be an incredibly difficult one. I think it just kind of automatically gets kind of, it's assumed that all childcare responsibilities kind of fall to the mother, I think, largely for a lot of the time. And for that reason, it's just sort of expected. I don't think employers even consider sort of partners as being sort of a joint, having joint responsibility for that role. And I guess even when you're sort of working out childcare costs, a lot of the time, sort of, I can talk about my own experience as well, when you're trying to work out the cost of childcare against your own salary, it's so easy just to think about your own salary and not actually the household salary. And again, that just proves the societal norm that it is largely falling on mothers and it's the responsibility of the mother. I'm not sure how we change that. I don't know whether it's got to kind of come top down, I think, really, in order to really make that change. But I think it's been an issue for decades, and I think unfortunately it's probably going to be an issue that's likely to carry on. But Mary, you probably have a lot more experience in that area to provide a probably more informed response.
So one of the key things that I think could be done in terms of public policy is around leave entitlement. So we have a situation where women are entitled to a year's maternity leave and men are entitled to 2 weeks paternity leave. There is what's called shared parental leave. It's not really shared parental leave, it's transferable maternity leave. So fathers and second parents are only entitled to it if the mother has the entitlement to leave in the first place. She has to give up some of her leave for him to get it. And it's complicated, and it's not really paid at a level that people can afford for the family to take it. In most heterosexual couples, the father tends to be the higher earner, and so if you're going to be on a period on statutory maternity pay, which an awful lot of people will be because their employers don't top it up, then it's very difficult for the family to afford to forego the father's earnings in order to do that. And you know, we and many other organisations argued this at the time when it was introduced. This is not the way to do this. What we need is a period of leave that fathers are entitled to in their own right, which is on a use it or lose it basis. It's not transferable, and is paid at a level, a decent level. I mean, when we need maternity pay paid at a decent level beyond the first few weeks. And that can make a difference, because it's, you know, if you have a situation where the mother is at home with a baby for a year and the father is off for 2 weeks and then back at work, that automatically establishes the mother as the expert on the baby and the father as the slightly sort of bumbling assistant who doesn't quite know what he's doing. And that sets roles that actually most couples don't intend. You know, I did some research years ago with Mumsnet for the Equality and Human Rights Commission, and one of the things that found was that most couples went into parenthood wanting to have an egalitarian relationship and wanting to share care. And then they suddenly, one mother said, I suddenly woke up and found myself back in the 1950s. And I thought, how did this happen? This was not what we intended to happen. So I think having those sort of leave policies, but also thinking about how we communicate with new parents. So I remember, you know, when I was pregnant and a new mother, you know, you buy all these books, endless baby books. I had hundreds of them. And they've all got these massive sections for mothers about returning to work. Should you return to work? What is it going to be like? How are you going to manage it? Nobody asks fathers, partly because you've only had 2 weeks off. There's a brilliant book by a guy called Duncan Fisher, who was involved in setting up the Fatherhood Institute, called Babies Here, Who Does What, which goes through, you know, what fathers do and talks about all the research to show that fathers' kind of emotional response is as keenly honed as mothers to newborn babies crying, and all of these sorts of things. And it's very, very good and accessible. And that's about trying to encourage couples to have conversations about who's responsible for what. But I think actually a lot of it is set with leave entitlements. And if we changed that, that would change a whole pattern later on down the line.
Thank you. Very insightful responses there. I've got a question each for both of you, and then hopefully we'll have a bit of time for another one to draw it together. But so, Mary-Ann, there's a question around how significant menopause and workplace support or lack of is important for economic activity in women aged 50 to 64.
I think that, you know, we're only now starting to realise, I mean, you know, women going through the menopause, many of us have realised the impact that it has on our working lives as well as on the rest of our lives. But generally, in sort of terms of public conversation, we're only starting to wake up to that and have that conversation. And I think that's really important. In terms of what's happening right now, I don't think that that's a significant enough, you know, nothing's really changed in terms of the impact of menopause on women. I mean, there may be intersections between menopause and COVID that we're not yet aware of. There may be, I mean, I don't know, it's not my area, but it does seem to be more to do with impacts of health impacts. The other issue where you're seeing more women appearing as economically inactive is that retirement age for women is going up. Which means that previously some women who would have been retired and therefore not working, but not able to work because of ill health, may now actually be having to retire early because of ill health, and so they are therefore recorded as economically inactive. And again, there's a real class issue there, because one of the things we don't talk enough about is healthy life expectancy and the period at which people become unable to continue in the labour market. And it really varies depending what sort of job you do. And if you do a difficult and physically demanding job, you are more likely to suffer ill health later in life as a result of that job and have to retire early and then be included in this economically inactive group.
Thank you very much. And Vicky, just was my own question actually, but really interested in around how much difference there was, or how much set apart first time mums compared to mums who were going through it, you know, not for the first time.
Yeah, I think kind of the experiences were pretty level between both parties, but those that did have older children were really sympathetic for new mothers, because those with other children had actually had a normal experience of pregnancy and postpartum, whereas a first-time mother wouldn't have had those experiences. So they were able to kind of appreciate the fact that it would be difficult. I think first-time mothers really struggled with the fact that they didn't get to have like baby showers, didn't get to have those kind of first moments of parents and grandparents meeting the newborn baby, or even just seeing parents kind of see their growing bump kind of during pregnancy, and those sorts of things. So I think that was definitely stark differences during pregnancy, but overall struggles with isolation and just missing out on the experience generally. It was tough for both those that were going through it for the first time and those that had already been through it previously.
Thank you very much. I could talk to you both for hours, honestly. Thank you. It's been so insightful. Patrick, you've popped up. So
thank you, Fiona. So I don't have access to the chat function of my version of Teams. Absolutely awesome stuff. Absolutely awesome. And so many takeaway messages for me. 70% of mothers asking for furlough have been denied. 1.7 million Great Britain adults have completely exhausted their savings. I mean, these are excruciating things. But I also had a look at the folk who are on this call. We had a really well attended event. Only 4 males, 3 of whom are amongst the organisers. So that suggests to me that there's also quite a lot of work to be done here in the academic and service communities, which is a little dispiriting. Sorry to end on a bit of a downbeat note, but it is very striking.